Hello, this is Sam Hazledine, our founder of MedWorld, with another edition of our Better Together podcast. And today I'm really happy to be interviewing Dr. MeiLan Han, who has very graciously agreed to be here. I didn't realize it was Memorial Day in the United States, and so she's here on a public holiday, a rare public holiday for an academic doctor. So thank you for being here. Dr. Han is Professor of Medicine in the Division of Pulmonary and Critical Care at the University of Michigan. She's an accomplished physician, and she's also a researcher, also an academic. And interestingly, I think from our perspective, she's taken a prominent public advocacy position, and as part of that serves as a spokesperson for the American Lung Association. She is currently an associate editor for the American Journal of Respiratory and Critical Care Medicine and serves on the editorial boards of Thorax, Lancet, Respiratory Medicine, and the Journal of COPD, of the COPD Foundation. She is also a member of the Global Obstructive Lung Disease Scientific Committee, which is charged with developing internationally a recognized consensus statement on COPD diagnosis and management. So she is a busy doctor. Welcome, MeiLan. It's great to have you here.
Thank you so much for having me.
Absolute pleasure, and looking forward to understanding a bit about you, a bit about your specialty area, and seeing what wisdom you can impart to our audience. I mean, firstly, I'd love to know why you chose medicine. Why did you decide to get into the medical field? And I guess as part of that, has anything surprised you? Anything you weren't expecting?
So I grew up in rural Idaho, and I know we've got a very global audience here, and so that may not mean much to some people, but it's a very rural part of the United States. Maybe not unlike certain parts of New Zealand.
Sure.
But I didn't have a lot of exposure necessarily to medicine. My mother was a nurse, and I actually thought that she worked way too hard, and I decided I didn't want to do that. But then I actually had a high school teacher who said, I really think this might be a good fit for you. You should think about it. And so I trusted her, and I took it to heart, and I started looking into it more. And then the thing that honestly clinched it for me was I had the opportunity to I don't even know if they call it this anymore, but they used to in the U.S. call it candy striper. So candy striper was a volunteer, usually like a junior volunteer at a local hospital. So I was a candy striper.
Okay.
For the local hospital. And because of the rural location, it wasn't very heavily regulated, and I got to do pretty much everything. Assist in the emergency room. I was there for, codes and procedures. And I thought it was one of the most exciting and thrilling things that I'd ever done. And so I think at that point I was pretty much hooked. But one of the things that I still value most about medicine, I think, is that there is so much value in the work.
Mm-hmm.
And you can feel good about, doing something that's interesting, exciting, and that at the same time you're really helping people. I think the other thing I love about medicine is that, and you asked me what were some of my biggest surprises. I think when, particularly when you're younger and you think about medicine, you think about sort of just this, you think about the doctors that you had growing up, right? So you think about the pediatrician, and you imagine what that life is like. And I think perhaps one of the greatest joys and surprises for me is that medicine is so flexible. And there are so many things you can do on a daily basis that are not just, necessarily going into the office and seeing patients, although I still do that and enjoy that. There have been so many opportunities to do other things and influence change. So that's, I think, for me over time, become something else about medicine that I really enjoy and value.
Yeah, and that strikes me, when we speak, how enthusiastic you are about the profession. And, as you'll know, a lot of doctors are struggling. I recently did a study and was looking at a cohort of doctors. 1 and 2 were in burnout pre-COVID, 2 and 3 are in burnout, now. So COVID has been really tough on us, but we were already struggling as a profession. And I'm interested in that, your enthusiasm. I mean, have you been this enthusiastic about the profession always? Have you had any struggles in terms of burnout? And I think one of the things one of the words I heard there was flexibility. And I think that's interesting because not all doctors see medicine as a flexible profession. Some of us see it as a very prescribed course with very limited flexibility. And I'm interested in your perspective on that. There's a lot of questions there, but I guess it's, have you always been this enthusiastic? Did you have any struggles? And what do you put it down to, being this enthusiastic about our profession?
I think we've all struggled, right, at certain points of time. And, I actually took over as chief of the division here at the University of Michigan in January. And so I am now, I like to think, I don't know what the best word is. I like to think of myself as sort of like the shepherd in chief
Yeah, okay.
I have roughly 70 pulmonary faculty that I have sort of under my charge right now. And burnout has definitely impacted everyone across the health system, right? But particularly pulmonary and critical care, where we
Yeah.
really got hit. And Michigan, where I live, is on its just finished its, or sort of in the middle of its fourth surge.
Oh, wow.
So it has been brutal, and so many of my faculty, particularly unfortunately female physicians, I think, have really had it the worst because of childcare impacting them
Right.
even more so, and not being able to get their work done and things like that. So I am acutely aware. I guess I'm also fortunate, though, in that academics in particular has afforded me a lot of flexibility. And one of the things I actually like about my career path, I guess, is that it's changed a lot. So when I first graduated from fellowship, I thought I was going to do primarily just focus on clinical medicine.
Right.
And then I had the opportunity to get a master's degree in clinical research,
Yeah.
and that led to me then starting to get more involved with research and doing papers. And then I got into doing clinical trials and data analysis. But then I've also, as you mentioned at the intro, I've now in the last few years had the opportunity to also get more involved with advocacy and trying to push for change at a national and international level. And so maybe I had not actually sat down to think about it before our interview, but to a certain extent, I guess I do keep reinventing myself. So,
Yeah.
and have continued to find new avenues to sort of focus my energies that keep me inspired. At the beginning of the pandemic, because of my being a spokesperson for the American Lung Association, I did another podcast, which in the U.S. is popular. It's called Freakonomics.
Oh, yeah.
And so after I did it was all about rationing and talking about mechanical ventilators and how we breathe. And after I did that, an editor at a large publishing house in New York heard it, and he reached out to me, and that's what led me to actually write a book.
Oh, yeah.
During the beginning of lockdown, and that's opened up a whole wealth of opportunities. But one of the things that I think is so fun about medicine, I guess, is I always think, when's that next bend around the corner that I don't know is coming, right? Like I didn't anticipate the book.
Yeah.
But getting to do that is like, led to things like this podcast even. And
Yeah.
so I guess maybe I'm an optimist, but I'm always excited about what that next bend around the corner is going to be.
Yeah, I think and that seems, it's such a great way of looking at life, isn't it? And I think something I've learned, I guess, in the last few years, when you're younger, and you're at medical school, there's that total focus, isn't it? Get into medical school, get through it. And I think, there's times when you need that in your life just to be, blinkers on and there's a single goal. But over time, and particularly with having children and other parts of life, I've become much more open to being surprised by life. And I think when you approach things with that, and it sounds like you're the same, it's like, what could come up? And if you're open to being surprised, then it allows you, I guess, to sort of step through those doors as they open and not just be, stuck on a single path. And I just think it's really interesting because I talk to a lot of doctors who struggle with medicine, struggle with what they see as a very prescribed course, and keep the blinkers on, get your specialty, get your specialist ticket by your mid-30s, and then what? am I going to do exactly the same thing for the next 30 years? But I think what you show, what you live, is that there is no one path.
Yeah, I think that is. It's funny. I was speaking to someone recently, and academic currency for us is writing papers, right?
Yeah,
And
yeah.
she said to me, "Well, after you write that paper, do you just feel empty? Do you just like, yeah, it was kind of exciting, but then she was saying to me, where is the joy?"
Yeah,
And it's funny because that had never sort of I'd never thought about it that way. But I guess for me, yeah, there's almost a creative aspect
sure.
to the whole process. Even being in something that seems sort of as cut and dry as research, right? It's how you present the data, how you get that message out, how you help it have impact.
Yeah,
And just kind of, so yeah, so I think I'm always thinking and looking for that next thing that I could do, where sort of where those passions align between medicine and helping other people.
yeah. I love it, and it's led you, and it's led to a very obviously rich current place in your career, and who knows what comes in the future. And I guess that's pretty exciting. You seem like you're quite a curious person, curious as to what could come next.
Yeah, but I think to a certain extent, this, I know this is sort of like, I guess, a little bit like a philosophy, but if you kind of keep yourself sort of open to the universe to a certain extent, right? But you also kind of have those core values and things that are important to you always kind of front and center, then I think that really helps you sort of, when I don't know whether it's you create those opportunities or you attract the opportunities. I'm not sure which it is, but if you're sort of kind of open and out there, and what's important to you, what you're looking for me in general, ultimately, the opportunities have at some point sort of presented themselves. And it's, has it been perfect? No. Have I had disappointments? Absolutely. Have I always gotten every job that I've wanted, or whatever grant that I've applied for? Is every paper I've been submitted not accepted? Of course not.
Yeah, yeah,
um, but ultimately, yes, I have very much learned to enjoy the journey.
yeah, yeah. I think you make a good point, though. Um, there is no real way of answering, is there? Whether you create the opportunities, whether you attract them to you, or whether you just notice the opportunities that have always been there. It's if it's purely a brain reticular activating system thing, but that actually doesn't matter. I've spent a bit of time thinking about it, and the conclusion I got to is it actually doesn't matter. It does actually work. If you remain open, life seems to, the opportunities do present themselves to you. Look, I think one of the things that you've done is taken quite a public position within our profession. Advocacy and education, both of doctors and patients, and at a higher level in terms of advocating for change. I guess at a governmental level. What was it that was there anything that lent you towards making you decide to lend your voice to what it is that you are passionate about and care about? What was it that made you step forward and I guess put your head above the parapet? And the reason one of the reasons I asked this, it was interesting. We're doing this this research around COVID and burnout, and I spoke to a lot of the doctors who we researched, and I was talking to the media as well, who were really interested in actually sharing this story. And of the doctors who were prepared to share their story, not a single one was prepared to put their name to it. And the reason for that was they were just like, we don't want to be seen as agitating. It's going to hurt us. It's going to be harmful for us. And so that very much seems to be quite prevalent within medicine. Is we try and keep our head down. And you've obviously put your head up. And that comes with all sorts of things. What was it that sort of made you become a voice? And why don't you talk about what it is that what you are a voice for?
Yeah. It's funny because there is part of me, and maybe this is just part of our training as physicians, but there is part of me that every time I hear my name or see my name or something, or hear someone talk about me, or someone says, oh, she's an advocate or social media this or whatever, I cringe. There is part of me that continues to
Yeah.
cringe
Yeah.
because there is a part of that that's so anti my usual nature.
Yep.
And so the question is it worth, kind of fighting against that to kind of pop your head up? And I even worry, I worry about, we all worry about negative reaction from the public, but I honestly also worry about negative reaction from my own colleagues.
Mm-hmm.
Because that they might not think I'm credible, or it doesn't make me as good of a researcher, or or that others will say, well, why is she, she's just hungry for the spotlight, or I can in my head imagine a million reasons why um, others might not view it in a positive light, right? So having said all that, about, I don't know, I can't remember now, maybe 10 years ago, the American Lung Association had approached me to be a spokesperson for them, which was really sort of my first sort of major foray into advocacy. But, one of the things that drove me to enter pulmonary medicine in the first place is that, at least in the US, many of the patients who have chronic lung disease tend to be socioeconomically disadvantaged. They live in rural areas. And I'd always sort of had a heart for that patient population. And that was part of why I chose to study chronic obstructive pulmonary disease, and had focused much of my work. And so it seemed to me that I had a group of patients that still were really struggling. They were getting funding. We didn't have cures, and somebody needed to help be a voice for them. And so I think that was ultimately what got me to sort of my frustration around the issue. And my specialty in general, and I don't know if this is true in New Zealand, but in the United States, cardiology seems to trump everything. Cardiology and maybe oncology. But pulmonary, generally speaking, has not received a lot of attention, public health funding, nothing. We don't screen for the disease. We don't create drugs for diseases. And even now with a COVID-19 pandemic, despite that, little has gone into understanding lung disease. And so I think ultimately at some point I just got really frustrated. I felt like the patients didn't have a voice. Somebody has to advocate for these patients. And so I just sort of slowly started trying to, get myself out there a little bit more to see if we could make some headway. But I think over the last couple of years, what really I think has kind of sort of propelled me a little bit even go at this harder in the last year really has been COVID, because I saw, sort of this crisis where the lack of public health funding for respiratory diseases and research for respiratory diseases, I feel really did contribute to the excess deaths that we saw with this pandemic. And so, I think it's sort of that frustration and maybe it's sort of just this global physician frustration with the situation that is, I think, just kind of fueled me even further since the pandemic, that we absolutely have to get more done to understand lung disease, to prevent, patients from going into respiratory failure, recurring respiratory failure, et cetera. Everything that we saw played out in millions of people across the world during the pandemic, I think we could have done better. So I think the pandemic, in a way, is just sort of helped to confirm my resolve on the importance of this issue. But at the same time, you are right. There is part of me that still cringes a bit.
I mean, it's the case with a lot of doctors, I think, who do take a public position. I think Danielle Jones is a friend, and she's known on social media as Mama Dr. Jones. She's got like 2 million followers, and when I met her, I was just so interesting, like yourself, very grounded, very down to earth, and I think you mentioned values before, And to me, that seems to be the thing that differentiates the doctors, who take a really public position, who it differentiates them in a really positive way. I mean, what are your values? What are you? What's important to you?
Yeah, I think, ultimately trying to help patients, finding cures is sort of, yeah, I think ends up being what I call sort of my true north.
Yep.
And if something comes up where there's an opportunity or a way that I think I can actually make a difference,
Yep.
it either, on a local level or, at whatever that level is, then if that resonates with me, then that's something that, ultimately will be, important to me and something that I'll pursue. I think there's definitely a lot of noise right now, right? There's a lot going on, and you probably get emails about this, that, and the other thing, and contact, please do this, please do that, blah blah blah. But so you're right. I think in order to, not that I'm great at this, but I think in order to keep your own self from burning out and kind of staying true to yourself and having enough energy for the things that are important to you, at least over time, I found I need to be a lot more selective
Mm-hmm.
about where I focus my energies.
Yeah, yeah, and I think values they're a great filter for picking opportunities that are going to move towards, as you say, your true north. I mean, it sounds like, I mean, I think all doctors want to make a difference. Whether and I think, from a medical school perspective, it's, we start with a one-on-one patient,
Yeah.
making a difference. I mean, you've mentioned that you saw the need. Was that the only thing that shifted you from just making a difference with individual patients to making a more a difference with many people? Was that the thing that really was what made the difference?
Well, part of it, interestingly enough, was the process of writing this book
Oh yeah.
too. So I'd already got. So I guess for people who don't know, I wrote a book during the pandemic. It's called Breathing Lessons, and it explains to patients how their lungs work. But there's also the whole last chapter is all about kind of the crisis of lung health and where we're at right now and what we need to do to move forward. But the interesting thing is that I think you've probably heard this phrase before, and I don't own this phrase. It's been coined by others, but I still like it. And it's this concept of like everyone has their own zone of genius.
Mm-hmm.
And in, after I did that Freakonomics podcast and then I started to work on the book and I worked with my editor on it, etc., I came to realize that one of the things that I was good at was trying to break down complicated concepts into things that were simple and understandable and could really convey a message, whether that's to patients or to, like I said, policymakers or public health officials, et cetera. And so I think kind of going through that experience and coming to the realization that there was maybe this like one thing that I was good at,
Yep.
or was came naturally to me. It made me realize that was something that I should capitalize on and that I should kind of lean in. Well, if that's the one thing I'm good at, then maybe that's the one thing I should lean in on with, and to see if I can help make a difference.
Yeah, yeah. Because I mean, with medicine, and that's an interesting thing, isn't it? With medicine, often doctors do speak a language that patients nod and say yes to, but really don't understand them. I mean, you are obviously good at getting your message across, whether that's at a policy level, whether it's to other doctors, or whether it's to patients. Have you applied? What sort of principles do you apply to actually making your message understandable? Are they marketing principles, or did you learn that, or do you naturally do that?
Well, I think that there's a couple of things. One, I naturally think in metaphors.
All right.
So and also like I'm never the smartest person in the room. Never. My colleagues always understand and grasp things probably more quickly than I do. So by the time I chew on something long enough to understand it, to break it down for myself, at that point it's pretty simple. So it's not so hard to explain to someone else once I finally figure it
Yeah.
out.
Right.
Um, as sad as that sounds. So so I think that that's part of it, but also, as part of my work through the American Lung Association, I did get a little bit of quote unquote media training.
Yeah.
And what I realized from that training was that, everybody wants to hear a story, right? And the more that you can kind of craft your message into a story, the more interested people will be in it, and also to just kind of, when you're talking about a concept, to have the I guess the idea in your mind that you're presenting, you're framing something for someone in a new way, and kind of offering that up as a gift, and to think about the presentation or whatever it is you have to say as this like idea gift that you're giving to people, is sort of a way to get them engaged and more interested in what you have to say. So I think there's probably, maybe, like I said, a certain amount of the way I frame things that helps, but I've also had the opportunity to learn from a lot of people along the way as well.
I really like that concept of an idea gift. I mean, I have a belief that every doctor has a message, or has something that they're really good at that can help other doctors, and that's part of our MedWorld platform. We've got a part on that called Insights, and Insights is where doctors can publish everything that's not covered by clinical papers. Well, when I was looking into how do we move the needle, or how do we start to move the needle on doctors and our well-being, and what I call the health of medicine, which is the individual doctor, it's our community of doctors, and it's how we practice medicine. What I found really interesting is that while we love practicing everything as much as we can on clinical papers, and it's great to have clinical papers, and I'll just share this now. I've been published once recently. It's not the Lancet, it's the Journal of Holistic Healthcare, but whatever, I'm published, and I'll take it. In this room, you're definitely the smartest person. But anyway, what I found is that, actually, it's less than half of what we do is covered by clinical papers. There's a huge amount of our medicine, which is the art of medicine. It's the conversations, it's leadership, it's management, it's running our medical businesses. It's how we interact with colleagues. It's how we manage our finances. It's how we have a relationship within the world of being a busy doctor. Like all these things that actually make up what we do in medicine. And so we created this thing called Insights, which is where doctors can publish what's going really well for them. That's not covered by clinical papers. There's a lower standard of evidence required because it's on personal experience. But I love that idea of that publishing, and it's an idea gift. It's how do you frame something in a way that someone might just get a different perspective, because you don't necessarily have to give someone the roadmap. Sometimes all you have to do is open someone's mind up to a different way and allow them to come to their own conclusions.
Yeah, absolutely. I'm excited I have to admit, I didn't know about your publishing site, so I will be excited to check it out. But you're absolutely right. The sad and funny thing is that the farther along I've gotten, I spend more and more time doing administration and less time actually seeing patients. And the thing that bothers me well, there's multiple things about that bother me, but there's just so much to be learned from interacting with individual patients. I have learned so much from my patients about how to diagnose, how to think about disease, just how to interact with people, everything. It's such an amazing learning lab. And so that's the one thing that I worry about, is I want to continue to learn and grow as a physician, and not having as much of those experiences worries me. So I love this idea of doctors being able to share their own, sort of nuggets of wisdom, on a central site, so we can all learn from each other.
I mean, even that, just what you said there, opens my perspective up. Learning from our patients. It's like where do you learn best as a parent? You learn from your children, don't you? You don't learn. I mean, yes, you learn from books and you can learn from other parents and stuff, but the journey of being a parent is the greatest, the greatest challenge, and the greatest, it helps you to become the best parent you can be. but interestingly, changing that perspective, well, patients can be that, that's the similar sort of relationship, isn't it?
Absolutely, absolutely. I mean, right? I mean, you can only learn so much in medical school, but I think 99% of what we learn about being a doctor and how you diagnose and just that art of medicine comes from just doing it
Yeah.
and being with patients one-on-one.
No doubt. I mean, I know when I finished medical school, one of the best things I did when I started work as a doctor was make friends with the nurses and just ask their opinion before I made any decision. Amazingly, how often I agreed with that opinion as a junior doctor. Is it, I guess, pulmonary health is your passion, your area. Are there any things within pulmonary health that doctors that you find that doctors don't know that would be just beneficial for doctors to understand?
Well, I think one of the things that I've come to realize, sort of in the process of writing the book this last year, and just thinking about sort of the crisis of lung health, generally speaking, is that we have to remember that the lungs really develop in three phases, and there's sort of this in utero phase, there's the childhood phase, and there's the adult phase. And I think the misconception, at least the misconception I had when I started practice, was that most people get to adulthood with generally healthy lungs. We would know it if they were unhealthy, wouldn't we? And then, through unhealthy behaviors or dusty or dirty jobs, people accumulate lung damage, and that determines who gets sick. But it turns out that that is not the correct rubric for how to be thinking about lung health.
Really?
So a lot of stuff can happen in development, even in utero, even like nicotine and air pollution exposure to moms can actually damage developing lungs. The prematurity is a huge issue. We've got more and more babies that are being born prematurely now than ever. There is so much stuff that can happen during childhood. And because we don't routinely measure lung function, the only way to get this data is looking at life course trajectories. And there's only a few such studies. Actually, there's a really great Tasmanian cohort study, and I actually have regular calls with those investigators. But when you look at these life course studies, what you find are huge variations. There's kids that have delayed growth, kids that have supernormal growth, and everybody ends up getting to adulthood somewhere. It's a huge normal curve. And like I said, I think we made this assumption that everybody was healthy, but we weren't checking, and we still don't check. So there's a lot of people that are entering adulthood with stunted lung growth, even though they may have normal height.
Yeah.
And what that leads to then is when you look at people that then get impaired lung function in adulthood, that group of people that we finally pick up lung disease in, it turns out that there's a significant number of those that never reached adulthood with normal lung function in the first place.
Wow.
And that was actually one of the key factors. So because of that, we have to really start thinking about lung health as something that starts in the womb, and we have to start talking to our patients about how we protect the respiratory health of their infants. We have to start talking to parents about, respiratory immunizations. This means things like anti-idling policies in children's schools. It means thinking about indoor air pollution within the home. Outdoor air pollution, obviously vaping and smoking when kids start to get into middle school, etc. And then, of course, there's all the adult stuff. But even there, while we typically think, oh, well, it's the smokers, or, oh, it's the construction workers or the coal miners. Well, there's also the nail technicians and the hairdressers and all these other people that are, sanitation workers, people that are also exposed to a lot of chemicals and unhealthy air and things like that. So I think if there was, just maybe one thing that I would say, it's that we have to, as healthcare practitioners, start taking a much more, global view over the life course when we're thinking about how to help, particularly with respect to disease prevention for our patients.
Yeah, okay, fantastic. I mean, and doctors can play a huge part in that education piece, isn't it? I mean, that's obviously part of what you're passionate about is education. And I guess if you understand that, you can play a much bigger role with parents and, with young people. And I guess also as well, there's also an element of it can help with the compassion you have for your patients, because I think it's an interesting point when you said that, and I was like, oh, what's my understanding? And I guess when I reflected on it as you were talking, it's almost like as doctors, we kind of think, well, all lungs are created equal. Well, nothing else in the body is created equal, is it? So why would it be the case for lungs? And so yeah, that's a really interesting perspective from a doctor.
Yeah, I think one of the problems is that traditionally lung disease has had a lot of stigma attached to it because we just assume, and doctors included, that, well, okay, if you have a chronic lung disease, it's probably because you smoke,
Yeah,
you had unhealthy habits, it's probably your own
yeah,
fault.
yeah, yeah,
And it's just not the case. And well, and we also don't hold any other disease to that same standard, right? We don't not treat heart attacks or invest in lung or in heart research because somebody ate too many cheeseburgers or whatever it was.
yeah.
So we that's just not a helpful way of thinking about it. But to be honest, sort of the burden of the problem became even more clear to me during COVID because, for instance, just as an example, they estimated there were in the American West when we had wildfires during one of the COVID surges, an excess 20,000 cases of COVID and 1,000 deaths just in this area of Oregon that had COVID and wildfires going on at the same time.
All right.
And so for the first time, you could actually measure an exposure, air pollution, at a very specific outcome, COVID infections, because both were being actively tracked at the same time.
Mm,
And what that tells me is that outside of COVID, there's probably a lot of lung damage going on for a lot of us all the time that
mm.
goes under the radar. We wouldn't have noticed except we had a respiratory pandemic and somebody was measuring. But how does that actually contribute to, chronic lung disease over time, or some other respiratory, getting sick from the flu or other respiratory infections? So I think what that tells me is that the problem just sort of needing to be more conscious and messaging about prevention and sort of this concept of lung injury is probably even more profound than we gave it credit to. And I think it's become more obvious, at least to me, because of the pandemic.
Yeah, well, and hopefully, maybe that'll be one of the positive things that comes out of the pandemic is a bit more resource towards this area.
Well, you would think. That's what you would think. But so far, it really hasn't happened. We've had tons of energy put into COVID vaccines and to COVID specific antivirals, which is great. It's
Mm,
important. Not saying we shouldn't have it because we've obviously come a long way and saved millions of lives because of it. But we've seen very little research into lung injury, into ARDS, into even like mechanical ventilator technologies or recovering
yeah.
or how do we help scarred lungs and things like that. So there's still, unfortunately, I thought there would be more movement on this area and there hasn't been. So I guess that just means I have a lot of work to do still.
I guess you do. Your voice is still required, but isn't that so often the case? I mean, it is quite a medical thing, isn't it? That you're dealing with the urgent and the important longer term stuff doesn't necessarily get the resource or attention it requires, and that's I don't say that I don't say that as a judgmental criticism either. I was talking to a friend of mine the other day, and there was a lot of criticism in New Zealand about why we hadn't increased our ICU bed capacity. We knew this pandemic's coming. We've had hard lockdowns to prevent big surges because we only had like 180 odd beds, ICU beds in New Zealand. We didn't have a lot, and
Wow.
so but we've managed it. We've kind of shut the borders and we've managed it in that respect. But there's a lot of criticism. But why haven't we just upped the ICU beds? And he was saying to me, he said, Sam, we're already operating at 120% capacity. And not literally in terms of ICU beds. He just said, as a profession, we're already well past capacity. He said, where's the excess capacity and bandwidth to be thinking about increasing, the ICU size and to be putting energy into this? He said, we don't have another spare minute in the day already. How can we approach it? So, it requires a different approach, doesn't it? It actually requires us to up resource at the kind of upstream as opposed to just go, well, leave it to the doctors to sort out, because if you're already operating at full capacity, there is no room to be thinking about this other stuff.
That is one of the most ironic things that has occurred during the pandemic, and that is that the hospitalists and the critical care doctors and the pulmonologists have all been so busy taking care of COVID that they haven't been out there to advocate. They haven't been out there to talk about some of these problems that you just mentioned, and they haven't been out there to, agitate for more funding or even apply.
Mm.
So the National Institutes of Health, for instance, here in the United States, has put out, specific funding announcements. Almost no pulmonologists have had time to do any of them because they're all so busy taking care of patients.
Yeah, right.
So it's sort of the perfect storm.
Yeah, yeah. And it's, I mean, and I guess it's one as a profession we're going to continue facing. And I guess there's a couple of ways we've got to think about how do you make change within a broken system, and the other is how do you fix the system. And I think we need both approaches.
And we have to think about how to be more flexible. Definitely, I'm not sure what the solution is, but I've definitely spent some time thinking about how do you build in surge capacity. And there's definitely, I think, more physicians and more critical care physicians that are actively trying to work through those issues and think about, what can we do at a system
Yep,
level
yep.
to try to fix that? Because I'm sure this will not be our last pandemic.
Absolutely not. Absolutely, and would be silly to think it will be. I would imagine.
Unfortunately.
Yeah, exactly, exactly. Look, I'm sure we could keep talking for ages, but as I spoke with you at the start, we've got doctors listening, and so they're probably the page has probably gone off 15 times already. So just to finish up, if you could go back in time and speak to your 18-year-old self, what are the three most important things that of advice would you give, whether it's medical or life advice? What advice would you give to yourself to help yourself live, a great life?
Well, that's a hard one. I've been thinking about this. So, I think one of the things, I don't know, maybe this is unique to me. I don't know. But I think when I was starting out, for sure, the process of getting into medical, just getting into medical school is hard. Surviving medical school is hard. It's very competitive, right? And
Yep.
then there's, who gets picked for this residency and who gets picked for that fellowship, et cetera, et cetera. And it can be very hard on your ego
Yeah.
and very hard on sort of your self-esteem. And so I think I probably, if I had to go back and talk to my younger self, I would have said something along the lines of, you are smart enough, you are good enough, and to have, more confidence in yourself and your ideas, and just
Mhm.
really, you're smart enough, and, and your ideas are good enough to still be able to make a significant contribution.
Yeah.
So I think that honestly probably would have been the main message to my younger self, to not stress out quite so much, to not be quite so anxious, and to realize that, there's, I think there's so much room in medicine for so many people to make different kinds of contributions,
Mm.
and everyone will ultimately kind of figure out their own path.
Yeah, that's a great piece of advice. And just the way medicine's structured, it's structured in a really great way to make really smart people feel really stupid, isn't it? It's the hardest course pretty much to get into at university. And so, then if doctors aren't getting onto training programs or aren't, you've got to remember the cohort that you're in. And just the fact that you've got a seat at the table, means you're infinitely smart enough to make an impact. That your ideas are worthy. That you've got something really valuable to offer, and there are different ways to do that.
And you don't have to be the smartest person in the room necessarily to do that.
No.
I think that's really, I think it's even harder now. I mean, I have a young son, and I think about, just like, I know you mentioned you have daughters. I think everything has just gotten more and more competitive and just harder.
Yeah.
And to try to still kind of, in this uber competitive environment that we live in, and particularly in medicine, when there are so many just smart, amazing, accomplished people, how do you kind of retain some sense of, still feeling good about who you are, and what you can do and what you can contribute and accomplish can be really, really hard.
Mm.
So I think that it's a little easier now. I mean, I worry about other things now, but I think, yeah, if there's any way you could kind of give yourself a little bit of window that like it's gonna be okay.
Yeah.
I think that would have made a difference.
Yeah. Yeah, absolutely. It's a great piece of advice. And I'll just finish up and you've got a lot to offer and a long way to go, no doubt. But how do you want to be remembered?
It's funny. Someone asked me recently if I thought I was successful, and in many ways, I actually don't feel particularly successful. In that, I think I measure my own success in terms of winning hearts and minds,
Mm-hmm.
and I don't always win the hearts and minds of my patients in terms of convincing them to adopt healthier behaviors or take their medications. And but on a more health system wide level or health policy level, there is still so much work to be done.
Mm-hmm.
So I don't know what dent I'll be able to make, but I'm hopeful that I would be remembered as having made some dent in
Yep.
something,
Yep.
in making something a little bit permanently better.
Yep.
And so I don't know which of my multiple swings at the plate
Yep.
will ultimately have an impact, but I pray that one of them does.
Yep. Well, you're having a lot of big swings at the plate, so you're giving yourself the best chance you can of denting something. That's for sure. Oh no, look, I think I say it jokingly, but obviously you're having a huge impact on multiple levels. Look, MeiLan, this has been a really fantastic conversation. I love where we started. You're talking about this openness to reinventing yourself, because I think that's a really valuable thing. As I said, I talk to a lot of doctors who feel a bit stagnant in medicine, and I think to me that's a powerful lesson, is just being open to reinvention. I think you spoke about the zone of genius, and I think again that's another piece. We're not all the same as doctors. We've all got different skills and skill sets, and it even speaks to the final point. Our zone of genius may or may not be into getting onto training programs. It may be being a public advocate. It may be, who knows? There's so many ways we can make a difference, and I guess the piece as well. I'm building businesses to help doctors. And through MedWorld, like that's the course I've taken, not as a practicing doctor. There are so many ways in our profession. We do such meaningful work, but we are also so broken in many places. Maybe not broken, but there's a lot of area for improvement. And I love the perspective of thinking about sharing our ideas as idea gifts. I think that I've taken a lot from this conversation myself. So, look, thank you for putting your time into this and taking time out on Memorial Day to speak with the doctors and myself and the doctors who are listening. It's been a real pleasure, and as I said, it's opened my eyes to some great perspectives, and I've enjoyed that.
Well, thank you so much. I really love the conversation, and I'm excited to check out your website more.
All right, we'll stay on. I'll stop this recording and I'll stay on. I'll have a chat with you. But look, to those doctors listening, I hope it's been of value. I'd be interested to hear if you took different messages from me, because we've had a good conversation. I'm sure there are different pieces in there that everyone's taken. So look, I really enjoyed it. Thank you again, MeiLan, and thank you everyone who's been listening.